There is $40 million sitting on the table this year, specifically for rural medical practices and clinics. Not a loan, not a reimbursement. A grant, federal money, with your name on it. If you know where to look. And according to the team at Texas AI Consulting, who work at the intersection of healthcare and AI engineering, most small practices have no idea these programs even exist. I'm Jennifer, and this is Texas AI Consulting. Today we're walking you through the real federal grant landscape for rural healthcare in 2026. The programs, the dollar amounts, the eligibility rules, and exactly how to position your practice to win. Before we get into the money, here's why Texas AI Consulting is the right voice on this topic. The firm was founded by Elliot Lamboy, a 22-year Air Force veteran, registered nurse for over 20 years, and IBM-certified AI engineer. A lot of his clinical career was spent in systems that served patients without easy access to specialists. Patients who drove 90 minutes for a follow-up appointment. Patients who skipped care entirely because the trip wasn't worth it. When Elliot moved into AI engineering, he noticed the same rural practices underserved in 2005 were still underserved. But now there are AI-powered telehealth platforms, automated scheduling systems, and workflow tools that could turn that 90-minute drive into a 20-minute video call. The technology exists. The money to deploy it? That also exists. That's the gap this channel is dedicated to closing. Let's establish the problem, because it's bigger than most people realize. Rural America is facing a healthcare workforce crisis. Physician shortages, specialist deserts, aging infrastructure, and the populations that depend on these practices are often older, sicker, and have fewer alternatives. The federal government knows this. That's why, over the last 5 years, multiple agencies, the USDA, the Health Resources and Services Administration, and the Department of Health and Human Services, have poured billions into rural healthcare infrastructure. The American Rescue Plan alone sent $48 million specifically into rural health IT and workforce expansion. Not broadband in general, health IT. For clinics, for practices, for systems just like yours. The problem isn't the funding. The problem is that most small practices don't have a grant writer on staff. So this money goes unspent. Or it goes to the larger hospital networks that have entire development teams. Let's start with the biggest one for practices looking to build out telehealth. The USDA Distance Learning and Telemedicine Grant, the DLT program. For fiscal year 2025, the USDA has approximately $40 million available in competitive grants. Individual awards range from $50,000 to $1 million. Here's what that money can pay for: interactive video equipment, computer hardware and software, network components, and broadband infrastructure. Basically everything you need to stand up a real telehealth practice. Not a workaround, but a fully equipped remote care operation. Who qualifies? Your community needs to have a population of 20,000 or fewer. That covers the vast majority of rural Texas and rural America. There's one catch worth knowing. Grant-only awards require a 15% match, meaning if you're applying for $100,000, you'll need to show $15,000 in matching funds. Crucially, that match cannot come from other federal sources. It has to be your own funds, state money, or private donations. The other thing to highlight, this program is competitive. The USDA uses General Field Representatives, GFRs, as your primary point of contact before you even start the application. This is not a form you fill out online and submit. You want to talk to a GFR first, understand the scoring criteria, and make sure your project narrative is tight. If you want the link to find your regional GFR contact, it's in the description. And here's where AI comes in, because the best ROI in any quality improvement initiative right now is AI-assisted clinical workflow automation, automated care gap alerts, AI-powered follow-up scheduling, risk stratification that flags your highest acuity patients before they end up in the ED. HRSA also provides technical assistance through the Rural Healthcare Provider Transition Project, essentially a team that helps small rural hospitals understand how to make this transition without having to figure it out alone. Beyond those two core programs, there are several specialized initiatives worth knowing about, depending on what your practice focuses on. For practices dealing with opioid and substance use disorder, the Rural Communities Opioid Response Program, RCORP, is a multi-year HRSA initiative funding community consortiums for care coordination and behavioral counseling. If you're in a county hit hard by the opioid crisis, this is a pipeline worth pursuing. For OB and maternity care providers, the Rural Maternity and Obstetrics Management Strategies Program, RMOMS, runs on a 4-year cycle, 1 year of planning, 3 years of implementation. Given the maternal mortality crisis in rural America, this is one of HRSA's highest priority funding lines. For broadband infrastructure, the USDA's ReConnect program funds construction and equipment for broadband at speeds of at least 100 megabits per second down, 20 megabits per second up. If your clinic is in an area where connectivity itself is the barrier, This is your starting point. Think about what happens when your telehealth platform has an AI assistant that handles pre-visit summaries, post-visit follow-up, and between-visit care coordination automatically. That's not science fiction. That's what forward-thinking rural practices are deploying right now, using exactly the grant programs we just talked about. And this is precisely what Texas AI Consulting does, taking federal funding and building AI-enhanced clinical workflows that create measurable, sustainable outcomes. Not just hardware, not just software, a complete transformation.